The St. Francis Foundation was established in 1977. Its purpose was to foster and promote activity for the healthcare system. We do that through raising funds and then distribute them in a way that supports the mission. That mission is to provide a ministry of healing, wellness, quality, and love, inspired by our faith in Jesus Christ. And there are a variety of activities we use for the fundraising, annual campaigns and events, grants, and special project fundraising. The Sister Esther Fund is one of our oldest funds that we have had since we started in 1977. It was named for one of the sisters here at the hospital at the time. Its focus is to help our patients who have difficulty transitioning from the care as an inpatient to the home or to a facility or to another place where they may not have the support that they need or the resources they need for a safe transition. And so a lot of times that can be transportation, medical equipment. It can be something at the home that the patient needs to have accessibility addressed. It's a variety of things, and just as unique as our patients are with their challenges, that we were able to tap into that fund and provide critical support at a critical time.
Gracie in 2020 was born August, and she was our miracle baby because we weren't sure if she was going to make it through birth. That's why I got to know this place. It looks a little different now. It's been a few years, but her being born 3 pounds 5 ounces, she had to stay a couple weeks in the NICU. And so that was a struggle in itself. We actually think that her overall diagnosis was spotted here at St. Francis when she was in utero. For the months leading up to Grace's delivery, I had to see 2 doctors. I had to see Dr. McWilliams along with Dr. Slacks, who I also credit saving Gracie's life as well, because it was him that talked me into having a steroid shot just weeks before she was born, just for the simple precaution of strengthening her lungs in case she was born early. And since she was so small, they were worried about her not being able to breathe on her own. Poor little thing, she wasn't hitting her milestones at all. Here she is, 7-8 months old, and she was acting like a 3-month-old. We had to start her on therapy. Her right leg was kind of bowing out and it wasn't growing right. It's straightened now, luckily with the help of therapy and other physicians, orthopedics and stuff. But poor baby can't walk very long. She gets wore out very easily. She's 2 years old, and then I find out I'm pregnant with our 4th. And now I'm having to juggle a hardly can walk toddler and a pumpkin seat, a baby carrier. So it was very hard, especially going grocery shopping, just going to Walmart, going to the doctors. It was a struggle having to carry 2 diaper bags because there was too much to carry in just one, and I would have had to carry a suitcase. And then Gracie and Colton too. So I had talked with Dr. Johnson about getting a handicap placard. So maybe if I had a handicap placard, that would allow me to park closer to doors, and then she wouldn't have to walk as far. And Dr. Johnson was like, well, maybe instead we get you something. So she had suggested, well, maybe we could find you a double stroller. And because I was like, I can't afford one of those. I looked, and they get expensive. And so she goes, well, I think we might have something. And I never in my wildest dreams thought that I would get something like I got. It was a Graco double stroller. It would fit his car seat and her And it had a big carrier on the bottom so I could put the diaper bags in. It had cubbies and cup holders and all that. And it was brand new, still in the box, and it got delivered straight to my house. So that was awesome. And she later told me that it was the foundation that you guys represent, the one that we're talking about now. And it, like, I almost cried because it was such a help. Knowing that there was somebody out there that cared enough to help my family, my children, when I needed it, made such a difference. I was able to have a breath. And when you're dealing with all the medical issues of your child, having to understand what's going on with them, having other family to deal with, everything to worry about, but yet all of a sudden having somebody reach out and help, even with just a stroller, you're able to, okay, I don't have to worry about that now. And having other medical issues in my family, that's always been a constant. And I have to say, St. Francis has always come through on giving us that breath. So when you give, just know you are making a difference.